Did you know that the concept of reproductive health was officially recognized by the WHO in 1994? Before that, health discussions mostly revolved around diseases and illnesses. Recognizing reproductive health as a holistic concept was a significant step forward. In this video, let's delve into a fascinating topic that concerns each and every one of us, which is reproductive health. Let us begin by understanding what reproductive health is. Reproductive health is not just about the absence of diseases, it encompasses the complete well-being of individuals capable of reproducing. Now, as we all know, our health is not just limited to our physical well-being but extends to our mental and social aspects as well. The same holds true for reproductive health. According to the World Health Organization, WHO, reproductive health can be defined as the total well-being and proper functioning of reproductive organs in all phases of reproduction. This definition goes beyond just the absence of diseases, it includes a complete state of mental, physical, and social well-being. So, how do we maintain reproductive health? That's a great question. There are various programs in place that are specifically designed for this purpose. These programs are like the superheroes of our society, working behind the scenes to ensure that we are all safe and healthy. These programs come in many forms, from small ads you see on TV to entertainment shows. Yes, you heard that right. Some television shows are not just for entertainment, they also have important messages about maintaining reproductive health. These efforts are often initiated by the government and non-governmental organizations, NGOs. Their aim is to promote safe sexual habits and awareness about various sexually transmitted diseases, STDs. By doing this, they contribute to the larger goal of achieving a reproductively healthy society. Objectives of reproductive health. The first major objective is to make quality maternal and reproductive health services accessible to people living in rural areas. This means ensuring that individuals, regardless of where they live. The second objective is to enhance the prevention of diseases that might affect maternal health. This includes efforts to prevent and manage diseases that could impact women's health during pregnancy and childbirth. The third objective aims to broaden the institutional and human resource capacities of local governments, health centers, communities, and the individuals, both men and women, involved in reproductive health. This involves strengthening healthcare systems, providing training and education, and empowering communities to take charge of their reproductive health. Now, let's take a closer look at the components of reproductive health. Family planning. Family planning is a cornerstone of reproductive health. It involves making informed decisions about when and how to have children. This component has a significant impact on the well-being of families and, especially, women. By using contraceptives and engaging in family planning, individuals can avoid unwanted pregnancies, space births, and protect themselves from sexually transmitted diseases. Sexual health. Sexual health is another crucial component of reproductive health. It refers to having a respectful and positive approach towards sexual relationships. This includes communication, consent, and mutual respect between partners. A healthy sexual relationship is a vital prerequisite for overall good reproductive health. Maternal health. Maternal health focuses on the well-being of women during pregnancy and after childbirth. It involves ensuring that women receive proper care, nutrition, and support throughout their pregnancy journey. Adequate maternal health care is vital for both the mother's health and the health of the newborn. Let's quickly solve a question to revise what we have learned. What are the programs called to get total reproductive health as a social goal of the national level? The correct answer is option B, family planning. Family planning programs were initiated in India in 1951 and were periodically assessed over the past decades. The programs were improved and covered reproduction-related areas under the popular name Reproductive and Child Health Care (RCH) programs. Now, let's discuss the common problems and concerns associated with reproductive health. Deformities. First on our list are deformities. These can occur during the development of the reproductive system or as a result of genetic factors. Overpopulation. Overpopulation is a challenge we face globally. Overpopulation puts immense pressure on resources, infrastructure, and the environment. Sexually transmitted diseases, STDs. Sexually transmitted diseases are another significant concern. The rise in STDs highlights the importance of safe sexual practices. Ill health of both mother and her baby. Ensuring the health of both the mother and her baby is paramount. Prenatal care, proper nutrition, and access to healthcare facilities are essential factors in this regard. Early marriages before attaining puberty. Early marriages, especially before puberty, can lead to various health issues for both partners. It's essential to raise awareness about the physical and emotional challenges faced by young couples. Increased mortality rate of both mother and infants. High maternal and infant mortality rates are concerns we must address. Access to quality health care and proper prenatal and postnatal care are vital in reducing these rates. Now that we've covered the problems, let's explore some strategies to improve reproductive health. Strategies to improve reproductive health. Sex education. The introduction of sex education is a crucial step in creating awareness among adolescents about safe sexual practices. The government has recognized this need and implemented programs to educate young people about the consequences of unsafe sexual practices and early pregnancy. National Adolescent Education Program. This program, aimed at students from classes 9th to 12th, plays a pivotal role in educating adolescents about reproductive health. It covers topics like infertility, birth control methods, pregnancy, and post-childbirth care for both the baby and mother. Combating evil practices. Our society still grapples with harmful practices like female infanticide. To address this, a legal ban has been imposed on the amniocentesis test, which was often misused for gender-based abortions. This is a significant step in safeguarding the rights and lives of female infants. Let us quickly revise what we have learnt by solving this question. Amniocentesis involves the analysis of. The correct answer is option D. Amniocentesis involves the analysis of amniotic fluid is withdrawn. It contains fetal skin cells and a number of proteins, especially enzymes. Now that we've discussed the problems and strategies related to reproductive health, let's dive into why reproductive health is so vital. Understanding its significance is crucial for leading a healthy and informed life. Importance of reproductive health. Reproductive health plays a significant role in preventing the spread of sexually transmitted diseases, STDs, like syphilis and AIDS. Safe sexual practices and awareness can help reduce the transmission of these diseases. A healthy reproductive system contributes to the production of healthier offspring with better chances of survival. This ensures the well-being of future generations. Spreading awareness about sex education is not just about individual well-being, it's also a powerful tool for controlling population growth. Preventing a population explosion helps in maintaining a balance between resources and the number of people relying on them. Teen pregnancies are often unwanted and can have adverse effects on the health of both the young mothers and their babies. Reproductive health education can empower teenagers to make informed choices and avoid these early pregnancies. In the past 50 years, India has made significant strides in improving reproductive health, largely due to increased awareness. The knowledge and understanding of reproductive health have grown tremendously, leading to better practices and outcomes. Understanding the benefits of smaller families through the use of contraceptives is not just about family planning. It can also lead to economic growth for families. When parents can plan their families, they often have more resources to invest in their children's education and well-being. Now, let's briefly touch upon the obstacles and approaches in the realm of reproductive health. Obstacles and approaches. As mentioned earlier, population explosion is a significant concern. Awareness and access to contraception are essential tools in managing this challenge. Deformities and reproductive health issues can be addressed through medical advancements and prenatal care. Ensuring the health of pregnant mothers and their babies is crucial. Access to quality health care and proper prenatal care can significantly improve outcomes. Early marriages are a concern that needs attention. Education and awareness about the risks of early marriage are essential to curb this practice. Preventing the spread of STDs requires education about safe sexual practices and regular health checkups. Efforts are underway to reduce the mortality rate of pregnant mothers and their fetuses. Government schemes and programs aim to provide proper healthcare services and promote a better standard of living. Let us now delve into a pressing global issue that affects not only us but the entire world: the topic of population explosion. Our world is constantly changing, and one of the most significant changes is the rapid increase in the number of people on Earth. But what is this population explosion all about? Well, it's the term used to describe the tremendous increase in the size and growth rate of a population. It happens for various reasons, such as improved health facilities and better living conditions. Now, let's break it down step by step. First, we've witnessed a remarkable decrease in death rates. Thanks to advances in healthcare, people are living longer lives. This is fantastic news, but it also contributes to population growth. Another reason for the population explosion is the decline in maternal and infant mortality rates. Fewer mothers and babies are dying during childbirth or shortly after, which, again, is fantastic news. But it also means more people are surviving and contributing to the population. Lastly, an increase in the number of people of reproductive age is another factor in this explosion. More people are reaching the age where they can have children, and when they do, it adds to the population surge. So, how do we prevent this population explosion from getting out of hand? Well, there are some methods that have been suggested. Raising the marriageable age to 18 years for females and 21 years for males. Delaying marriage can lead to smaller families as couples have fewer years to have children. Rewarding couples with fewer children can motivate them to limit family size. Encouraging the use of contraception can help control population growth. Now, shifting gears, let's talk about something related but different: the amniocentesis test. Ever heard of amniocentesis? It's a medical procedure used to determine certain things about an unborn baby by analyzing the amniotic fluid surrounding the fetus. But why is amniocentesis performed? Well, it can tell us a lot. It checks if the baby's chromosomes are normal. This helps diagnose genetic disorders. It can detect neural tube defects like spina bifida. An early diagnosis allows for proper care. It looks for signs of infection in the baby. Early detection can prevent complications. And it can even determine if the baby's lungs are ready to breathe. This can be crucial for planning medical care. However, like all medical procedures, amniocentesis has its risks, including the possibility of miscarriages, injuries, cramping, and even preterm labor. But rest assured, injuries to the baby are exceedingly rare thanks to modern technology like ultrasound guidance. Did you know that amniocentesis was banned in India in 1994? This was due to the Preconception and Prenatal Diagnostic Techniques Act. Why? Because amniocentesis could reveal the sex of the fetus. In many parts of India, a preference for male children was prevalent, leading to the abortion of female fetuses. To combat this, India took a bold step and banned amniocentesis to protect the lives of female babies. So, Students, in this video, we've covered some important topics. Reproductive health. We've learned what it is and why it's essential. Objectives and components of reproductive health. We've discussed what we aim to achieve and what makes up reproductive health. Reproductive health problems. We've looked at some common issues people face in this area. Strategies to improve reproductive health. We've explored ways to make things better. Importance of reproductive health. We've highlighted why this topic matters so much. Obstacles and approaches. We've talked about the challenges and how to overcome them. Population explosion. We've discussed the rapid growth of the world's population. Amniocentesis test. We've touched on a medical procedure to check on unborn babies. These are all important aspects of our health and society, so I hope you found this video informative and helpful.